next is अर्थात उन्माद प्रतिषेधम अध्यायं व्याख्यास्यामहे अथवा च भुवननगरी. In the series of manasika vyadhis, Unmada is the next condition which is mentioned in the Uttaradanta. Madayanti udgataha doshaha yasmad unmargam ashridaha manaso ayam ato vyadhi Unmada iti kirtitaha. The Unmada is defined as the vitiated doshas which tend to move upwards in the body. They will be affecting the psyche, the psychological conditions. Madayanti means which affect the psychological conditions, and hence it is called as Unmada. Ekekasha samastesha doshehi atyarthamurchidehi manasena dukkhena sa pancha vidhachyate vishad bhavati shastascha yathasvam tatra bheshajam sacha apavruddha taruna madasamnyam vibhaktihi. The types of these are Vataja, Pittaja, Kaphaja, as well as Manasa and Dukkhaja. And due to Visha also, toxic conditions also can produce the Unmada, and hence it is categorized into 6 categories. Moha Udvego Swanaha Shrotre Gatranam Apakarshanam Atyutsaho Aruchishta Anne Swapne Karushabhojanam Vaina Unmathanam Chapi Brahmas Chakrakata Seva Yasyasya Achireneva Unmadam so adhigachyati. The prodromal symptoms of Unmada are confusion, anxiety, a tinnitus, sounds heard in the ear, and this impairment of the growth. That's the patient may have weight loss or excess of activity and anaruchi, that's anorexia, and the having dreams, in the dreams eating some unhealthy food, then or patient having more activity, hyperactivity would be the moving around like or giddiness like symptoms. These are the prodromal symptoms of the Unmada. Now from the current point of view, we defined schizophrenia. Unmada can be compared to the schizophrenia, and schizophrenia is defined as a brain disorder, and the latest definition of course is brain disorder that affects how people think, feel and perceive. The disease where there is a disorder of the thinking, method of thinking or method of feeling and perception is considered as schizophrenia. And according to the Diagnostic and Statistical Manual of Medical Disorders, latest edition, 5th edition, to meet the criteria of diagnosis of schizophrenia, the patient must have experienced at least 2 of the following symptoms: either delusions, hallucinations, disorganized speech, or disorganized or catatonic behavior, that's unusual movements of the body, or negative symptoms. The patient may have some total negative approach to the society, social conditions. Any of these, or at least 2 of these, should be there to confirm a diagnosis of schizophrenia as per the latest protocol of making the diagnosis. Now these are exactly the same which is mentioned in this Samhita. The conditions like the catatonic movements, the abnormal movements of the body, or the thought process are the same features. The typical clinical symptoms according to the doshas would be Rukshachavihi, Parushava, Dhamani Tatova, Shitaturah, Krishatanuh, Spuritanga Sandhi, Aspotayati, Atati, Gayati, Nrityashilaha, Vikroshati, Brahmati cha api Anila Prokopata. A Vataja Unmada patient may have a dry appearance, and his speech may be harsh, and he may seem to be emaciated, the vessels may seem to be prominent, and he will have a weak body or emaciated body, and the joints in the body also may be having a more movement, and his behavior would be he tends to move around more rapidly, he may sing, dance, etc., or maybe cry or maybe shout, etc. So he will be having a hyper excited behavior. Hyperactive behavior is the characteristic feature of Vataja Unmada. Trasveradaha bahulaha bahubuk vinidraha chaya himani jala antara vihara sevi tikshna himam nije vannishanki pitta diva nabhasi pashyati tarakascha. The Pittaja Unmada would be a patient having a delusion where the patient may be seeing the sky with the stars, or he may even feel like even a cold water also may be felt as if there is a fire, and he may have eat more, and he will have a lesser sleep, and he in the dreams he may just enjoy, or he may be having the dreams of the playing in water, in dipping in water, and he will have more sweat or more thirst also, and burning sensation throughout the body. Kaphaja Unmada patient would have Chardi, Agnisada, Salana, Aruchi, Kasayuktaha, Yoshid Viktarati, Alpamati Pracharaha, Nidraparo, Alpakathano, Alpabushna Sevi, Ratro Bhrisham Bhavati Japi Kapha Prakopatam. The Kaphaja Unmada patient would have a depressive behavior. He will be feeling sleepy, and he will not speak much, and he prefers to have warm food, and he will not have sexual urge. His sexual urge will be lesser, and the total intelligence also will be lesser. He may have vomiting, impaired appetite, and the cough also may be presented. Sarvatmake Pavanapittakapaheta Swam Samharshila Ivartilingam Mudirayampi. In the Tridosha Unmada, all the dosha symptoms could be seen. Choreihi Narendra Purushehi Aribhihi तथा अन्येहि वित्रासितस्य घनबान्धव संशयाद्वा गाढं क्षते मनसि च प्रियया रिरंसोः जायेत उत्कटतरो मनसो विकारः. The manovikara unmada can be produced due to the fear by either thieves or king, or maybe the enemies, because of the fear of that, or due to loss of either close associates or maybe the money. There would be a injury to the manas, the psyche would be affected, and or even love break also. Those who do not get that affection from the others also may have the manasovikara, that unmada may occur due to the psyche. Chitram sajalpati mano anugatam visanyah gayati atho hasati roditi mudasamyah pratyakshano hatabala indriya prabha subinah shavanam vishakrute athabhavet parasuho. Now, such a manonugata patient would have a unusual behavior. He will be speaking irrelevant speaks as such, and he may even have a impaired consciousness. He may sleep, he may sing, he may laugh, or he may weep also. Whereas Vishakrataha, those who are due to the toxic conditions, would have reddish eyes, his vitals would be affected, he will be having a reduced activity, there could be a bluish color over the body, and he may even die. Now, from the current point of view, the schizophrenic conditions are categorized as patients with the positive symptoms, negative symptoms, cognitive symptoms, or mood symptoms. These are how the categorization is done, and of course, when the prescription for schizophrenic conditions are selected, these are based upon the same. In the positive symptoms, patient may have hallucinations, which are usually auditory, delusions, or disorganized speech and behavior, something like the Vataja Unmada Lakshanas. Negative symptoms, like where the patient would have a decreased emotional range, poverty of speech, has lesser speech, loss of interest and drive, and the person with schizophrenia has a inertia, dull as that's typical of Kaphaja Lakshanas, Kaphaja Unmada Lakshanas. Cognitive symptoms, where the patient may have a impaired memory, and he will have a difficulty in executing the functions, and his internal personal changes, like relationship will be affected, more or less clinical symptoms of Pittaja Unmada Lakshana. Patients who have impaired mood, like they may be at times may seem tearful or sad, or that is difficult to understand, or they may be even depressed. Of course, maybe something like a Tridoshita Unmada. Now, as far as the principles of the treatment is concerned, Snigdham Swinnant Manajam Unmadartam Vishodheta Tikshnehi Ubheto Bhagehi Shirasasti Vilechanihi Vividhi Outvideshta Sarshapa Sneha Sanitehi Yojaitvat Tachurnam Grhani Tasya Predayate. Now, the main line of the treatment of Unmada, according to Sushoda, is the Vishodhana, both Vamana and Virechana, with the Tikshna Dravyas, or Tikshna Nasyas with Sarshapa Sneha. The mustard oil is used for this Sneha, with the different Krishna dravyas. Or dhupana, satatam dhupayashcha enam, shva gomansehi suputibihi, sarshapanam tailena nasabhyango, nasya abhyango hitau sada. The dhupana has to be done with the flesh of either dogs or cows and with the sarshapataila, and abhyanga with the sarshapataila also is suggested. Darshayat adbhutani asya vadet nasham priyasya भीमाकारेहि नरेहि नागैहि दान्तैहि व्यालैश्च निर्विशैः भीषयेत् संयतं पाशैः कशाभिर्वा अथ ताडयेत् यन्त्रयित्वा सुवृत्तं वा त्रासयेत् तं तृणाग्निना जलेन तर्जयद्वापि रज्जुघातैः विभावयेत् बलवांश्चापि संरक्षेत् जले अन्तः परिवासयेत् प्रतुतेद् गारयाच्चैनं ब्रह्माघातं विवर्जयेत् वेश्मनो अन्तःप्रविशयेनं रक्षं सद्वेष्वदीपयेत् सपिधाने जरत्कूपे चतुलं वा निवासयेत्. One more approach of the treatment is a vitrasana, or giving some sort of shock to the patient. Of course, now from the current approach of the point of view, psychiatric patients given such kind of treatment where their activity is restricted and where the patients are threatened is completely avoided. Only the electroconvulsive therapy is the suggested treatment where the patient is under anesthesia and then ECT is given. The other sorts of the treatment is banned now, should not be given. But Sushruta, of course, till very recently, even in the Western medicine, one of the approach was the same, like to make the patient shock with certain psychological conditions, physical injuries and so on. But now they are banned. Now it's only the ECT which is allowed, whereas the other way, the Sushruta's approach is also a approach which was useful for a long duration, and to make the patient fear or to have a shock, it could be like the patient may be shown something which is adbhuta, which is not seen otherwise. Fearful scenes could be shown, or you may just tell the patient that some persons who are very close to him have died, or patient may be made to be feared with the strong persons, or maybe these elephants or any other wild animals which are not poisonous, and or maybe patient may be made to be feared with the whips or maybe ropes, etc. And he may be even beaten to a certain extent, and he may be tied to a pole, and maybe he may be have to be feared with the trinagli, that's comparatively low heat producing fire, or he may be made to fear with water, or but when you make you may be even dipped in water, but at the same time take care of his protection, should not have injury. So non-injurious threatening activities are suggested, and at the same time whenever you do any of these protocols, ensure that the patient's vitals are not affected. So such protocols are suggested as a treatment. And then the other treatment is trahat yavagumscha tarpanan va pradapayet kevalan ambuyuktan va kulmashan va bahushrudahan hridyam yaddeepaniyam cha tathatyam tasya bhojayet vidanga trifala musta manjishta dadimotpadehi shama yela valuka yedabhi chandana amaradarubihi barhischa rajani kushta parnini sarivadvayehi हरेणुका त्रिवृद्दन्ती वचा तालीसकेशरैः दिक्षीरं सालितं सर्पिः मालती कुसुमैः सह गुल्म कास ज्वर श्वास क्षय उन्मादनिवारणम् एतदेव हि सम्पक्वं जीवनीय उपसंहृतं चतुर्गुणेन बुद्धेन महाकल्याणमुच्यते. Mahakalyanaka is also suggested as one of the treatment. Even now we get the product in the name as Mahakalyanaka and the contents of Mahakalyanaka are Bidanga Tripura, etc. Or the patient may be given Yavagu, Tarpada Yavagu, that's light food which produces nourishment, or liquid food also can be given with kulmasha. Kulmasha is something like idli. Anything which is liked by the patient could be given. Apasmaram, Graham, Shosham, Klaibim, Karsham, Abhijatam, Ghrutam etat nihantyashu, Yecha Ado Gadita Gadaha, बर्हिष्ठ कुष्ठ मंजिष्ठ कटुक एला निशाक्वैः तगरक्तिफला हिंगु वाजिगंधा अमरद्रुमैः वचा अजमोद काकोली मेला मधुकपद्मकैः ससस्करं हिदं सर्पि पक्वं क्षीरचतुर्गुणं बालानां गृहज्येष्ठानां पुंसां दुष्ट अल्परेतसां ख्यातं फलकृतं स्त्रीणां वन्ध्यानां चाशुगर्भदम्. The same Mahakalyanaka Ghrita, or it could be another Ghrita, that's the Phalaghrita, which also can be used with the Barshista Kustamanjista, and which could be used in many other disease conditions along with the Unmada Apasmara. Brahmim Aindrim Vidangani Vyosham Hingum Suram Jatam Vishagnim Lashanam Rasnam Vishalyam Surasam Ujam Jyotishmrim Nagaram Anantam Abhayam Tata सौराष्ट्रीं च समाशाने गजमूत्रेण प्रेषयेत् छाया विशुष्काः तद्वर्तीः योजयेत् विधिको विदः अवग्वेदे अंजने अभ्यंगे नस्ये धूमे प्रलेपने. Another Varti yoga is prepared with the same drugs and it could be used for avagveda nasya, anjana or abhyanga or nasya. Uro apanga lalateshu siraschasya vimokshayet apasmara kriyam chapi graho dishtanta karayet shanta dosham vishuddhamcha sneha bastivi achareta. The patients of Unmada also can be treated with rasabheda over the either chest or apanga on the lateral part of the eye or lalata on the forehead. And all the treatment protocols of apasmara or graha also can be used in the treatment of Unmada. And once the patient has become somewhat normal, stabilized, sneha basti can be given. Unmadeshu च सर्वेषु कुर्यात् चित्तप्रसादनं मृदुपूर्वं मदेप्यैवं क्रियां मृद्वीं प्रयोजयेत. शोकशल्यं व्यपनयेत् उन्मादे पञ्चमेऽभिषेक विषये मृदुपूर्वा च विषग्निं कारयेत् क्रियाम्. In the manasika created Unmada, due to the psychological hurting, if the Unmada has occurred, in such conditions, the patient has to be given anything which pleases his mind, chitta prasadanam should be given, and all mrudu chikitsa, mrudu dravya has to be used for the treatment, and all mrudu kriya have to be used. Shokasaldam vapanayat. If the patient has a situation of sorrow which has created Unmada, that has to be removed, that situation has to be removed or cured as such. With this, we conclude this chapter. Iti Sushrutamitaam Uttaratantrantarte Bhuta Vidyatantre Unmada Pratishedho Nama Tritiyodhyayaha Adhyaha Dvishasthitamo Adhyayaha. We will continue with the next chapter, which is comparatively less important and a relatively short chapter again. अथा तो रसभेद विकल्पम अध्याय व्याख्यास्यामहे थोवच भगवन्तमन्त्रिः. This chapter deals with the rasabheda, the possible permutation and combinations of different rasas. Now, these are mainly useful in the context of preparation of different medicines which would be suitable for the patient, where the combinations of the rasas are used. But from the current situation point of view, where we use prepared medicines and mainly rasaushadis as such, these become somewhat less relevant. In Charaka and Ashtadhyayi, the rasabheda is mentioned in the context of Shodhana, where the different types of the sneha pravicharana, the patients who are to be given sneha and the patient doesn't like a acha sneha, these options, the different options are given. Anyway, otherwise practically, the importance of this rasabheda in the practical clinical situation in the present day would be comparatively lesser. The issue is about the numbers, the different numbers of combinations of the rasas. It's a simple algebraic expression of the 6 rasas in different the sets as such. So it's a simple basic issue of algebra. The doshanam panchatashata prasaro abhitastutayah trishascha rasabhedana tat prayojanam uchyate tata ayojanam uchyate. The permutation and combination of the 3 doshas are considered as 15 by Sushruta, and those 15 varieties of the doshas or 15 various combinations of doshas can be managed with the 63 ranges of the rasas, and that's depending upon the variations of the doshas. Like dosha paratama bhava. If vata is more comparatively and kapha is lesser, you will be preferring a more snigdha dravya and less madhura dravya and so on. That's the idea of this. Avidagdha vidagdascha vidyante te trishastidhaha rasabheda trishastintu viksha vikshavachare. The total 63 varieties of the rasabheda are mentioned, and those are ekekena anugamanam bhagashed yadudaritam doshanam tatramatiman trishastinte prayojayate. These 63 are to be used for preparing a specific custom-made medical treatment for the doshas. यथा क्रमप्रवृत्तानां युकेषु मधुरो रसः पञ्चानुक्रमते योगान् अम्लः चतुर एव तु त्रींश्चानुगच्छति रसो लवणः कटुको द्वयं तिक्तः कषायमन्वेति ते द्विकादशपञ्चच. The combinations of the two dosha rasas is prepared. Dvika is used and it's a process like initially the madhura with other combinations and the amla with other combinations, or the lavana with the other combinations, and these combinations are madhura amlaha, madhura lavanaha, madhura katukaha, madhura tiktaha, madhura kashayaha. Ete pancha anukrantaha madhurena. These five are madhura anukranta. That's madhura is a major rasa, and then the others the following. Then amla lavanaha, amla katukaha, amla tiktaha, amla kashayaha. Ete chatvaro anukrantaha amlena. These amla anukranta are four. Lavana katukaha, lavana tiktaha, lavana kashayaha. Ete trayo anukrantaha lavanena. Lavana anukranta are three. Katu tiktaha, katu kashayaha. Dvabeto anukranto katukena. Katukarasa anukranta are katukashaya and katutikta. Tikta kashaya eka eva anukranta tiktena. For tikta it's only the one which is suggested. Now in Ashtanga Hridaya the combinations of rasas are mentioned for the sneha, that preparation of the sneha pravicharana, as I told you, and that's yukta avachare sneham bhakshali annena bastibhi nasya abhyanyana gandusha murdha karnakshi darpanehi rasabhedeka ekekitvavyam chatushyashti vicharanaha snehas anyabhibhutatvad alpattvacha kramasmitaha. Ashtanga Hridaya mentions about 64, slightly one number more, and but in the Sutrasthana again this, it's mentioned as Sanyogaha Saptapanchashat Kalpana Tritishashira Rasanam Yogikte Nigla Stulam Bajre. In the Sutrasthana 10th chapter it is again mentioned as 63, so there is a slight overlapping of these issues, 63 or 64, not a major issue. But anyway, we will just leave it as such. Then Trikan, the combinations of the three rasas, Adau Prajamanastu Madhuro Dashagachati, Shadamlo, Lavanaha, Tasmat Ardham Ekam Tata Katuhu. The combinations are mentioned as Madhurati, Lavanati, or Katuadi. Madhura Amla Lavanaha, Madhura Amla Katukaha, Madhura Amla Tiktaha, Madhura Amla Kashayaha, Madhura Lavana Katukaha, Madhura Lavana Tiktaha, Madhura Lavana Kashayaha, Madhura Katutiktaha, Madhura Katukashayaha, Madhura Tiktakashayaha, Eva Mesham Dashanam, Tekasanyoganam, Adau Madhura Prajate. The 10 combinations are Madhura is the first one. Then Amla Lavana Katukaha, Amla Lavana Tiktaha, Amla Lavana Kashayaha, Amla Katutiktaha, Amla Katukashayaha, Amla Tiktakashayaha, Eva Mesham Shadnam, Adau Amla Prajate. In these 6, the Amla is the first one. Then Lavana Katutiktaha, Lavana Katukashayaha, Lavana Tiktakashayaha, Eva Mesham Trayanam, Adau Lavana Prajate. Katutikta Kashayaha evam ekasya adau katuka prajate. Evameva Trikasanyogaha vimshati vyakhyataha. The 20 are the combinations of the 3 rasas. Then Chatushka, combinations of the 4 rasas. Chatushka rasayogat madhuro dashagachati. Chaturo amlo anugacchecha lavanasu ekamevato. 10 are madhuradi and amladi 4 and lavanadi 1 only. And these are Madhura Amla Lavana Katukaha, Madhura Amla Lavana Tiktaha, Madhura Amla Lavana Kashayaha, Madhura Amla Katutiktaha, Madhura Amla Katukashayaha, Madhura Amla Tiktakashayaha, Madhura Lavana Katutiktaha, Madhura Lavana Katukashayaha, Madhura Lavana Tiktakashayaha, Madhura Katutiktakashayaha, Yevamesharam, Tashanam, Adau Madhura Prajate. Amla Lavana Katutiktaha, Amla Lavana Katukashayaha, Amla Lavana Tiktakashayaha, Amla Katutiktakashayaha, Evamesham Chaturnam, Adau Amlaha. लवणकटुतिक्तकषाय एवम् एकस्य आदौ लवणम् एवमेके चतुष्करसंयोगाः पञ्चदश कीर्तिताः. Then the panchakan, so combinations of the five. Panchakan, pancha, madhura, ekam, amlastu, gacchati. Five are of the madhura, eka, amla. Madhura amla lavana katu tiktaha, madhura amla lavana katu kashayah, madhura amla lavana tikta kashayah, madhura amla katu tikta kashayah, madhura lavana katu tikta kashayah, evamesham pancanam adau madhura prejate. Amla lavana katu tikta kashayah, evam ekasya adau amla, evamete shat panchaka yogaha. Shatkam ekam mukshamaha, ekastu shatka sanyogaha. All the combinations of the six rasas would be only one. Esha ekayava shat sanyogaha. एकैकस्य षट्रसः भवन्ति मधुरः अम्लः लवणः कटुकः तिक्तः कषायः इति भवन्ति छात्र एषः त्रिषष्टिव्याख्याताः रसानां रसचिन्तकैः दोषभेदत्रिषष्ट्यां तु प्रयुक्तव्याः विचक्षणैः. With this we conclude this chapter also. As far as the utility of this rasabheda in the current practical situation, virtually it's very less important. So we just casually look at the chapter, and as far as the pravicaranas are concerned now, we can prepare the food materials which can be useful or which can be used by a person as an alternative to the snehana, based upon the liking of the patient than really the rasa combinations. With this we will conclude today, and if there are any questions I will try to answer. Right, there are no questions. Wind up.